So, first I want to just, speak to the burden of infection. So there has been a lot of attention that's been paid to our older adult population. However, we haven't really paid close attention to really what's going on with our children. The AAP has been a great source of information, documenting that nearly 4 million children have tested positive for COVID-19 since the onset of the pandemic. However, the CDC estimates that when we adjust for underreporting and under testing that's happening in children, that perhaps as many as 22 million children and adolescents 5 to 17 years have been infected in the US since the pandemic began. So the burden of disease can be significant. I want to emphasize that I personally have seen kids become hospitalized. And I've actually, we've had children die from COVID-19 disease. It is a significant disease, although it is not as common to happen in younger children compared to our older adult population. Kids are also at risk. We know that amongst the hospitalizations we've seen in the US, that while 60% do have a high-risk condition, including obesity, asthma, developmental delay, immunocompromise, and diabetes, we also know that 40% of children who are hospitalized have no high-risk conditions. And so we can't predict who's going to be hit more severely by COVID-19 infection amongst our children. The other aspects of the benefits of vaccination, I think one that we have not talked about yet have been the long-term effects of COVID that we're now starting to better understand in both adults and children, this long-haul COVID. And I think we have a lot of work to do to make sure that we understand the full impact of the COVID-19 pandemic